As one of the people behind a new stream at this conference, what's your stream and why are you excited about it?
So I'm co-chairing this stream and about population. And the reason why I'm so excited is that we actually for the first time have this kind of stream at this conference. And one of the things behind having population into a stream is a way we can learn more from data. When we pull data about populations, can we learn more and improve systems around that?
Really, really interesting. So is the improvement the better use of data, or is it the data itself in healthcare?
No, I still think the interest is improving the outcomes for patients.
Yeah.
But we need new models to learn how we can use data on population to understand how we can actually improve for and together with patients.
So have you got any, you probably got some speeches or talks coming up, or you've already done some? What's the sort of stuff you've been saying around this, and how's it been going down?
So I will be chairing some sessions during these 2 coming days, and I'm excited to see the diversity of the abstract that was sent to us. So we will have presenters that present what you could say is a small local case on how you have worked with a community, a population in a community. And we will also, from the big stage, have a presentation with 3 countries presenting their work on population health. So there's a large diversity in this stream.
So how come this hasn't been done before in the quality improvement conference?
Yeah, that's a great question. I'm not sure. I think probably because we are still struggling a bit on how we can use data, and at least I can say from my country, we're very good at using data on a local base to see how we are improving, but and we have good data for individual patient groups. But when we see it more at a higher level, we're still in the first steps of that.
That sounds like an amazing area for improvement.
It is, and I think if we really want to change health and equity, we need to look at data in another way, and we also have to look at the different ways of improving health for a larger populations.
So do you think there's a lot of scare stories about data and health? Like, do you think people are right to be scared of big data, or yeah, how do you feel that plays out?
No, I'm not scared of data myself. At least I think one of the things in this stream is also to learn from other countries, because if we look at this conference, we are very much see people from the European countries, from the United States and Canada, but actually in this stream we will see also people coming from other countries that have other traditions, and maybe that is also new to us to look outside Europe, not only inside Europe.
Also involved in the population stream, we have
Dr. Dominique Allwood. I'm Chief Medical Officer of UCL Partners, a health innovation network, but I'm also Director of Population Health at Imperial College NHS Healthcare Trust.
So you're exactly the right person to be talking to about population health. Do you share the excitement about population being a stream at this conference?
Well, I'm super biased, as my job title says. I'm a Director of Population Health, so it's fantastic to have a conference like this that I've been attending as a delegate and a speaker for many, many years, really now pulling together lots of different sessions that have been on the programme over time into one stream to show and signal how important it is to have populations at the heart of our work and think about health from a broader perspective. So thinking about communities, not just patients, and healthcare beyond the walls of hospitals, and really focusing on health inequalities and equity.
So is data the key to doing that effectively in a kind of quality improvement kind of set of circumstances?
I think the answer to that is both yes and. So quantitative data, numbers and metrics about the population is undoubtedly really important. And during COVID, we've seen a lot of data being presented about health, and that's a really important thing to see. But in broader terms, data also refers to things like insights and feedback, and it's really important to go out and work with communities, patients and staff to bring back that more narrative and story-based data to supplement the measures and metrics. We need the measures and metrics to understand some of the harder impacts, but we do need both. And the great thing about this population health stream is it's showing some really innovative ways to involve people and patients and communities in their work and around their health and think about their needs for care.
So do you have an example that kind of makes you go like, "Ooh, that's the stuff"? Because I find that talking to people who are very, very embedded in a particular world, there's always one example that makes them go, "Ooh, that's the one." Do you have one?
I'm going to cheat a little bit on that because there are a few things that have really got me excited about the work stream and indeed the abstracts and examples. There's stuff that's going on that's really localized, looking at how do we tackle health equity in a system, a provider level system. That might be about who's waiting for care and the different types of patients that have to wait longer. So some really great local work that's being showcased, all the way through to global, international work across high, middle and low income countries, looking at global kind of health, and lots of things in between about innovative ways to engage with communities, how to collaborate and work with partners in health and beyond health, outside of the walls of our organisations, and really think differently about what it means to do improvement with a population mindset. So loads to be excited about here. It's like trying to choose favourite children. I couldn't possibly just pick one thing.
Yeah, you say that, but I bet you've got a favourite.
Oh, well, I've got a particular passion around method. So I think the mindset that you can bring from QI, whether that's a closed microsystem, patient safety focused bit of improvement, and take that into how you might tackle a huge health problem like something that relates to poverty or people not in work. And one of the examples that I really love is about organisations becoming anchor organisations or anchor institutions, and that's about how they can tackle wider aspects of health through the way in which they conduct their organisation. And there's some nice examples being showcased here about how improvement method is driving that. So there's lots to share and lots to learn here, and it's going to be a really exciting stream.
Final question. If you had to give a kind of inspirational call to the kind of data cause, what would you say to everyone out there who's kind of umming and ahhing, going, well, data, it's just spreadsheets and that? Like, what would you say?
I think data just paints so many powerful pictures and cases for helping to engage people in why change is needed and to help people engaged over time to show that it's having an impact. So I think you can't underestimate the power of data and measurement in this work, and we want to make sure that the work that we're trying to change around populations is really backed up to show that it is having an impact. People are busy, resources are constrained, we have to make really good use of those. So to be able to demonstrate that with data is really important.